welcome to another day with your fertility specialist, brought to you by Alps Hospital and Diagnostics. Today we'll be having a conversation, and we have members of the IVF team of Alps Hospital and Diagnostics with us this morning. Dr. Kenneth Aguza to my left, and to his left, Dr. Deborah Olubi. So this morning we'll be talking about something that is not always spoken about. Yeah, I'm sure you can see from my countenance already, right? It's not something that is always talked about, but we'll be talking about when IVF fails, what to do when an IVF has failed. You know, Dr. Ken, it's not usually a pleasant conversation to have, right? Yeah. So when did you say that an IVF has failed?
Well, let me hijack this discussion. Because I've spent half of my medical profession talking about failed IVF cycles. Yeah, it's a common sense that the reality is that IVF is likely going to fail than succeed. So if it's likely going to fail than succeed, I think it should be talked about in larger proportion or more of the times than when it fails. You know, but we find ourselves living in a society where people attribute everything to fate, you know, and they don't like to hear about bad things.
Yeah.
You know, and then even in the consulting room, for instance, when you are counseling with patients, with clients, you're going to talk about the chances of success. You see these clients make funny decisions, for instance. A woman at the age of 44 insisting she must use her eggs for an IVF treatment cycles, you know, and there are other reasons why it could fail, though. I guess we'll talk about that later. Yeah. So the reality is that it's very likely to fail. You understand? And when you say that your chances are this, you say, no, I'm not going to fail.
I believe God.
You understand?
Faith talk, right?
The faith talk,
Yeah.
you know. But yeah, in as much as I know that faith plays a very significant aspect of our being, you know, nature, you know, nature predominates what happens in IVF. And so IVF is more likely going to fail because the world success rate for IVF is about 32%. So if we're talking about the world success rate,
32%.
falling to about 32%, putting all age group together, doing all kinds of IVF, 32%. What happens to the 68%? It means a larger proportion of the 100% is failing.
Yeah.
So it's more likely going to fail. And then the doctors don't like it when it fails.
Yeah.
The clients don't like it when it fails.
Because nobody likes anything fails.
Days of pregnancy tests are usually actually gloomsday.
Yeah.
As a young medical doctor practicing IVF for a very long time, you know, I have watched my boss sometimes sneak into the washroom to wash his face because he had just had an emotional breakdown.
Yeah.
You know, the doctors also cry.
Yes.
You know, maybe sharing the emotions of failure with clients. You know, I was in a professional gathering out where in Europe, and then an IVF result is going to be announced in a certain hospital in Europe.
Yeah.
And I watched my boss trembling.
Oh my God.
You know, trembling. Because it's not a good time for anyone.
Yes.
It's just not a good time for anyone. You know, when I started IVF in a clinic in Jos Plateau State, then I wasn't the person at the helm of affair, but I was the brain behind the IVF.
Yeah.
You know, so when it's day to do the pregnancy test, for instance, the boss runs away from the hospital. Yeah, to be very frank. You know, he goes in hiding and then he leaves me, of course, because, you know, when you are not taking responsibility, it's easy for you to face the public.
Yeah.
You know, and then intermittently he calls, "Hey Ken,
How was this
How's it
person's
going there?
result?
how is it going?"
Because, you know, we become
Exactly.
intertwined in their lives. You know,
and
get to hear their hurt, their pain, the process they've been through. You know, you hear their challenges. You know, when you hear some stories of how people really get to come to be able to come to do IVF, you really feel for them when they
Yeah,
fail.
in
Yes.
Africa, for
Yes.
instance, you hear the story like I just sold a parcel of land
Yes.
to
Yeah,
pay
lots
my
of
way
people
through this
happen.
Yes.
IVF
My
I took
treatment.
a
God.
I
loan
took
to
a loan from a
Yes.
cooperative to pay this through this
Yes.
IVF, and then a good number of women will say, my partner is not supportive. I am doing
Yes.
this all by
On my
myself. For
own.
whatever
Yeah.
reason they are saying that you don't want to know.
Yes.
And sometimes it's so painful that the parent of the daughter of the lady comes to pay for her IVF.
Sometimes even a marriage, a whole marriage hinges on the result of that
Oh, the
IVF treatment.
Exactly.
IVF.
Once it
Wow.
fails, the marriage is over.
And then as,
So,
as an IVF
yes.
specialist, you
Yeah.
cannot guarantee anything.
Yes.
That's the reality. We only, we just do the best. I don't want to use the word hope now.
Okay.
We just do the best and make sure that all the dots all the T's are crossed and the dots in the right places, and make sure that we will not be responsible for whatever goes wrong. But we know it, that in a group of
There's a high
100 people,
chance.
not up to 40% will succeed. In a
It's a
lower
sad
age group,
reality.
you have up to 70%
Chance of
chances in
success.
lower age group. But
Okay.
of course, you have a large population of IVF being an advanced age group.
Yeah, of course.
And the uterus have gone through so many hots and tumbles, a lot of abnormalities, and then all those things have impact on the outcome of IVF treatment cycle. So yes, it fails.
Yeah.
Yeah, it succeeds too, but it fails.
Feels.
And anyway, it's so interesting that we say that even if it were going to be done by some demigods,
Wow.
it's still going to fail. That's how true it is. That is why you have failure from the United States. In fact, a lot more failure from the United States, a lot more failure from the European countries, and failure also in Africa. It's everywhere. Just like pandemic. Not pandemonium.
It's a worldwide
Okay,
phenomenon.
yeah.
It's everywhere. Yes.
So, what do you think are the reasons, Dr. Debbie? Now, what do you think are the reasons for this failure in the
Okay,
IVF cycle?
so if I go to that question, so we know when IVF has failed when the pregnancy test is negative.
Okay.
Like Dr. Ken said, it's not really a very happy day for everybody because failure affects not just the clients, but we, their healthcare providers, are also affected in the process. So
Sorry, sometimes after this failure,
yes,
you understand?
yes,
I lost my appetite for 2
definitely,
days.
Are you
definitely.
serious?
Sometimes I
Yes,
have this headache,
yes.
headaches.
So it's just as
conf-
traumatic
yeah,
for
yeah, yeah.
clients that.
And
Confusional.
Oh my God.
It's just like in
Yes.
psychiatry, you have acute confusional states. Sometimes you have this headache, your head is so full, you
In
lost
fact,
interest in everything.
breaking the news to some of these clients is a big turmoil, is a mountainous task to do. Just wonder, how do you break this news to them?
Yeah.
It's not always so easy, yes. So the IVF failure can be due to a lot of reasons. Some of the reasons could be due to poor quality eggs. We have a lot of advanced age women still wanting to use their own eggs. Yes, they've not accepted the fact that that age, the function of the ovaries has really wind down. These eggs have been in the ovaries from birth. A woman is born with all the eggs she will ever produce in her lifetime at birth. So imagine they've aged over the years. So at this point, you get very few eggs and their qualities are usually not great. So you can see that, what do we expect? We expect that an IVF treatment with those kind of eggs will likely fail. Also, poor quality sperm can also be another reason for failure. And then we have a lot of issues that could affect the uterine lining. That's where the embryos are placed. Things like adhesions, polyps, if these things were not diagnosed or taken care of before the
Prior to
IVF treatment
IVF.
process, yes. Even sometimes when you take care of them, when a lot of damage has occurred, there's so much you can do in the way of repair, So these issues you might not be able to thoroughly address them to the extent you would want. And then for this kind of problem, there's an option of surrogacy, but our people, don't really want to look at that option.
Yeah.
Yes, and then a lot of other issues. If there are multiple fibroids, especially impinging on the lining of the womb, you tell some women you need to have a myomectomy, a removal of these fibroids, and they don't want to have it. That could lead to failure of IVF too. Yeah.
Amazing.
Sometimes, You have guys who have problems with some medical conditions, like
Yes.
diabetes, for instance, and some metabolic disease conditions. They could have good number of sperms, but the sperms may
Poor
have been
quality.
affected by these
Okay.
medical conditions that they have. It will reduce the quality of the sperms and all of that. Now, the problem with sperm is that we know that in IVF, one of the indications for IVF is low sperm count. But then it's good to mention at this point that the fact that you could use a low count for IVF doesn't necessarily mean that IVF will be successful. Because for some people, they feel that because IVF is the last resort, when they hit the last resort, they should get a positive outcome. So when the sperms are low, for instance, whatever is making them low may be affecting them right to the head of the sperms, where the DNA, which are proteins, are located. For instance, varicocele in the testicles. They can hit up the sperms and cause a damage to the head of, to the DNA in the head of the sperms. Stressful lifestyle, especially in the part of the man, could elaborate a lot of oxidative radicals in the body, and even if the sperms are in tones and numbers, they may still not be able to cause someone to achieve pregnancy. Okay, so the reasons are numerous. There are metabolic reasons for the woman, medical reasons for the woman, age of the woman, and all of that. And sometimes even abnormal thyroid conditions could make all of this. So, and that is why you see when you come to talk about evaluation for IVF, you need to go to town evaluating them, because in the evaluation, you need to find out what is likely going to be on the way to affect this outcome. Now, it doesn't necessarily mean that all the evaluations will be poor. They may all be normal. Yeah, it is still part of evaluation. Evaluation doesn't necessarily mean that you want to have all the
You
negatives,
want to discover some pathologies.
or you could just evaluate and it's okay. Yeah, fine that this woman is in the
Yeah.
right condition to go through the IVF. And men don't know that failure of IVF may be as a result of sperms. And I tell you at this point that from our perspective and with the way the current sperms are in the world, more IVF failures are happening because of abnormal sperms than even with eggs. Because the advanced age women in the good places in the world accept donor eggs, but men can actually be very difficult to manage sometimes. Because we are the
You're the
men.
man.
We see this bad sperm so much, so many times, that sometimes I wonder, even though I brag myself to be extraterrestrial, I really sometimes ask myself, and the andrologists will work together. I say, aren't you guys worried about this kind of sperms you're seeing? Don't you think we need to go test our sperms and see
before men
whether?
become
Oh
extinct.
yeah,
They're still normal.
seriously.
A lot of bad sperms out
A
there.
lot of bad sperms. And my son actually, as young as he is, worries about his fertility.
Sperms. Oh my god.
Yes. He checks up on me.
Wow.
Sometimes, hey, that's where's your phone? I was like, okay. And there was a time I was actually having my phone in the pocket and he shouted, hey, dad, your phone. I'm like, man, what about my phone? It's in your pocket. It's in your pocket. I said, what about my pocket? You remember the research we watched? It's going to affect you. Yes.
Wow.
That's a 6-year-old boy.
Amazing.
Yeah, because he watches researches. We read research outcomes with him in reproductive medicine. He knows that sperms are a big problem. So yeah, a lot of reasons why IVFs could fail. Sperm is just one. Lifestyle. That's
Unhealthy
why
lifestyle, people that have been smoking for years, excessive consumption of alcohol, all those things can damage the sperm, can damage the gametes, the gonads.
These
the
days
ovaries,
we're talking about chemical destructor factor.
in plastics and so on.
Yes, you have a consumption of a lot of chemicals by women. The makeups they make,
Bleaching, toning
the
creams.
creams and all of that. These things are absorbed into the body. They absorb into the body, and then they disrupt the hormonal milieu of a woman. The thyroid hormones, the reproductive hormones, they all affect the process of reproduction. So they could also have negative impact. All the chemicals we are
because we even
affiliated
see
with.
a lot of younger age women producing very poor eggs nowadays. Yes, we
So
see that a
chemical
lot.
destructive factors.
Yes.
Sorry, endocrine destructive factors. These chemicals fall in that categories. Guys that work in farms in the middle of pesticides and all of that. So these are all the things that happen when that could make IVF
IVF
treatment
fail.
to fail. Just the lifestyle, the age, the sperms, the eggs, and all of that. And more these days, these things are getting poorer. So IVF is still going to fail. It's never going to stop failing. You know,
But it
but
also
it
succeeds.
succeeds.
also
Yeah,
It
it also
succeeds.
succeeds.
It gives up some joy, when it
Yes.
succeeds. So it fails. So when it fails, we expect that we give the client some time to mourn the loss. Mourn the loss. Then we call them up for a chat. And in this at this time, we look at every detail again. They may have been looked at before and even addressed before, but we go over it again. The reason is that you need them to have closure. This is a possible reason why, because whatever it is, at that point, faith does not matter anymore. It's not my portion. It's not my
It's now the
faith.
failure is staring
The
everybody in the
failure is
face.
staring. And
Yes.
sometimes you actually watch couples take very, very unfortunate decisions. I don't want to say stupid decision, unfortunate, because it's autonomy. They decide how they want it. Ours is just to counsel with them and to give them the statistics of what their chances are. Their responsibility is to choose what they want. But when they choose what they want, knowing that the chances are low, they likely fail, we still talk about it. And look at all the treatment from the laboratory to the operating room, embryo transfer room. Look at every stage, the quality of eggs, the quality of sperm, the quality of the way the embryos develop and all of that. Then we'll be able to find out what likely went wrong,
And what we can change
what
going
we
forward.
can change going forward.
We always encourage them to still try again. It has been said success rate for a first IVF is between 30 to 35%. With each treatment, success rate increases. Yes. So we definitely encourage them to try again. So we review the treatment, we look at what we can do differently. Sometimes what we can do differently might be stimulating the woman in another way, might be counseling them about the use of donor gametes, might be encouraging them to have a surgical procedure like hysteroscopy to look at the lining of the womb. So many options are available. People shouldn't lose hope. There's still so many options. Their baby dreams can still be realized even after an IVF treatment failure, yes. And that healing process is very important. It's normal to be angry, frustrated, even sad, but they shouldn't remain there. They should heal from that process. And we as their healthcare providers, we're always available, to help them through this process, and then even looking forward to having them do another treatment.
Yeah, that's what happens when it fails, That's just what happens when it fails. Very tough time to manage.
Really, I can say.
A very tough time to manage.
I was going to ask you both, how do you feel when an IVF, personally now, how do you feel when an IVF cycle fails for your client? How do you feel?
I feel very sad.
Depressing.
Unhappy.
Depressing.
I remember Dr.
You
Ken
almost get to
mentioning that
depression.
he loses appetite and
Yes,
All this happens to
because,
me,
and then sometimes IVF fails and you review the treatment and everything, and we can't really pinpoint what could be the cause of the failure. Sometimes that happens in a few times, But in that situation, we still encourage them to just try again.
Sometimes I work with Debbie, and our consulting room is like two rooms away from mine. Okay, I just tell the guys from the lab, send across to me all the failed IVF cycle. Let's do all the crying together, because as the big guy in the team, you need to step up to take responsibility, And man, sometimes when I'm out of the country and they didn't IVF, and they didn't pregnancy test, I just wondering. I was like, okay, now maybe it's time to rest, take some breather,
But sometimes on that day we get some joyous news. Some people, that have tried a couple of times get to succeed. Sometimes we get some amazing, should I say, miracles. People that, we're trying something in a new way and we see them succeeding. That gives us so much joy.
You mentioned earlier, sometimes in a Fertility and Sterility Journal of Reproductive Medicine in the United States, there are researches that say that after 6 attempts, the chances of success increases.
Increases.
So just as you mentioned,
Yes.
the more you try, the quicker or
yes.
the more your chances of succeeding.
Yes,
you know?
because each new trial, like we said, we review the treatment. We understand your body in a new way. We understand something different about your system.
I must tell you,
Yes.
one of the painful aspects of IVF for
Yeah.
me is this. We've treated couples and some of them didn't succeed. And then the next time you call them to encourage with them and they tell you that we're no longer together.
Oh my God.
Oh, yes.
Yeah.
With me, this is not more than 10 times. I mean, over the years that I've practiced. So you see, sometimes the last time you have to save a marriage is in your consulting room.
Yes.
And that is why we will not tolerate mistake coming from any quota. You know, all systems are doubly checked. The processes are checked by a second person because we may just be the last group of people to save a marriage. Because a lot of marriages in Nigeria or in Africa are hinged on having babies. You know, so it's actually quite painful knowing that your office, your consulting room may be a legal point where people end up their marital relationship. So it's quite painful when IVF fails, I must tell you. And then you need to see when they succeed, marriages that have broken up before
Yeah.
come back together again.
Yeah.
That's the beauty of it. But the failure, boy. Sometimes I think I will need to check what my BP may be like because the kind of headaches I have sometimes after this failure, man,
Yeah.
nothing just makes sense. And sometimes I wonder how I manage to drive home. Yeah, there are a few times, you know, I have to tell the driver, man, I don't think I'm in the mood to drive. Sometimes I go to my private office and sleep for some minutes just to get my acts
So back
together.
Together.
Yes, and if I have to do some sensitive surgeries, I just look for someone to lead the surgeries, because at that point I may not be in my right state of mind. So let somebody lead and let me be an assistant. So it's actually very traumatic. Very traumatic.
I'm sure clients do not know that.
No, they
healthcare
don't.
They don't know
providers,
that,
They don't
yeah,
know.
They don't
because
know.
yes,
You know,
they
they
don't.
don't know,
You know, a lot of times you see them coming to vent on their healthcare providers. We take it because we understand.
Yeah.
It's part of the grief reactions, yes, we understand, but they don't understand that we are going through it with them. Yeah, but some do. Some appreciate, you know, all your efforts and the care you've given them, and they know that it's not due to any fault of yours that the IVF fails. Yes.
So in a nutshell, when it fails, you know, everybody feels the pain,
Yes.
but of course I will assume that the couple
feels
feels it more.
Yes.
You know, and then, but what we do is that we give them time to recover or to mourn the loss of the failure. Then we'll invite back and look through the process again. You know, so we ask them to come back. We look through the process and proffer some solutions. Yeah, that's what we do when it fails. Then we stop all medications.
Yes.
It's time to breathe fresh air again.
So that's too much we can take. I'm sure you know that your healthcare providers are also mourning with you. Yeah. Thank you so much.